Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 16, Calc.sulph.2. If you are new to T.S.T, that is tissue salt therapy, viewing parts 1 to 6 is a must. A lot of technical thing has been described in 1 to 6. If you are new, you must know it. If you know something about T.S.T, you may skip this. Gastric symptoms of Calc.sulph: Craves stimulant to overcome the tremulous weakness, burning pain in stomach while eating, roof of the mouth sore, nausea with vertigo, great thirst and appetite, desire for fruit, tea, green, sour vegetables. Abdomen stool symptoms of Calc.sulph: pus like slimy discharge from the bowels, ulcerative colitis. That is number 1, image number 1. This is the picture of colon in case of ulcerative colitis. And dysenteric stool, purulent and bloody, Crohn's disease 2. This is Crohn's disease 2. These two diseases actually are a very incurable type, autoimmune disease. In modern medicine, there is no treatment. They have said this is incurable disease. They somehow manage the patients to drag on. But homeopathy and biochemical medicine conjointly can tackle the disease. Mind this, in both cases there is some dyscrasia in the what is called this immune system of the person. That immune system of the person has been, they has been turned defective owing to some trouble in the health of the patient. Now, constitutional homeopathic medicine along with Calc.sulph can cure in ulcerative colitis and also in Crohn's disease. Intestinal ulcer with typhus, painless boils about anus in cases of fistula, pain in liver area in right side of pelvis, followed by weakness, nausea, pain in stomach, purulent diarrhea mixed with blood. Purulent diarrhea mixed with blood is also part and parcel of these two diseases, that is ulcerative colitis and Crohn's disease. Actually, this is the main symptom of the disease. This purulent diarrhea or purulent dysenteric stool mixed with blood constantly goes on and on and on for months and months and months in case of these two patients. Easing of rectum, moisture of anus. Now rectum, this is the rectum area, mind this, above the anus, the rectum area, 10 to 15, last 10 to 15, just before, concluding portion is anus, 1 to 2 centimeter, thereafter 10 to 15 centimeter portion is called rectum. Now you can ask me why I am referring to this ulcerative colitis and Crohn's disease, because this I am treating a few patients of suffering from this with the help of homeopathic medicine and Calc.sulph, and both of them are somewhat better and better. They are passing this stool now occasionally. Most of the time they are passing normal stool. Urinary symptoms of Calc.sulph: urine red with hectic fever, chronic cystitis, image 1, with pus forming and nephritis. Hectic fever, hectic fever is a fever which never touches normal during a day, and the difference between low and high is lying between more than 1 degree to 2 degrees Celsius. This is hectic fever. Hectic fever implies that there is some infection, pus forming infection is going on in the system. Cystitis, inflammation of urinary bladder. This is a space of cystitis, place that has been, the enlarged picture is here, and this is prostate gland. This is a picture from men. Nephritis is inflammation of kidney. Male genital symptom of Calc.sulph: to normal suppuration of bubo. Bubo means swollen, infected lymph gland in the groin area. Alternately with silicea, that is silicea also required in these cases, because this bubo actually represents some sexually transmitted disease like clap. Clap is gonorrhea with purulent body discharge. Chronic suppuration stage of syphilis. Mind this medicine, Calc.sulph, can tackle both the two serious STDs, sexually transmitted disease. Two diseases, syphilis and gonorrhea, both can be tackled by this particular Calc.sulph if symptom agrees. Abscess of the prostate, spermatoria. Spermatoria is involuntary passing of semen during stool or urine from young men. This is a very common problem of young men, and young men generally suffer from a lot of depression owing to this disease, because they can feel that there is something losing from his system and he is going weaker and weaker. Yet most of the time, out of sigh, he cannot describe the symptom to others. Ulceration glands, inguinal limb glands, actually this gland, there may be ulceration also. Suppuration means actually coming out of pus. Unless there is ulceration, suppuration cannot possible. So this is implied. This gland is not suppurating, but it is swollen. Female genital syndrome Calc.sulph, menses late, long lasting with headache, twitchings and great weakness. Liquoria with thick yellow bloody discharge, clap. That is, in case of female, there is gonorrhea, maybe other also. In case of gonorrhea, female, this may be used. Calc.sulph. Respiratory symptoms of Calc.sulph: cough with purulent and bloody discharge, or asthma with hectic fever. Hectic fever I have already described. Hectic fever are fevers in where the temperature between low and high is 1 degree or 2 degrees Celsius, lying between 1 to 2 degrees Celsius, and the fever never touches normal temperature during a day, and it comes when there is some infection, pus forming infection in the body. Empyema means actually, you have to know this thing for if you know the covering of the lung, pleura. In the covering of the lung, when some pus accumulates due to infection, it is called empyema. With purulent and bloody expectoration, pneumonia, picture 1, this is the picture of pneumonia. When in pneumonia, there are so many focuses in the lung. These focuses are actually these places where exudative fluid has been accumulated in the alveoli. For that reason, pneumonia is a very serious disease. The alveoli are obstructed when fully occupied by this fluid, in exudative fluid, and the patient cannot breathe. The interexchange of oxygen in the alveoli are disturbed. So they are suffering from strongly loss of air. They feel air is less, and pain and breathness, shortness of breath, and also high temperature and chill in case of pneumonia. This is last stage of pneumonia. When the pneumonia, when this type of expectoration, thick yellow expectoration comes out of lung, this is third stage of pneumonia, and Calc.sulph help there. Bronchitis, this is bronchitis. Bronchitis means inflammation of bronchus. These are bronchus. This tree-like structure are bronchus. In the bronchus, there is accumulation of fluid, and also here the patient suffers from shortness of breath. But the difference is, in pneumonia there is great chill and high temperature. That is somewhat lacking in this case. Consumption, that is TB, burning, oppression and soreness in the chest. These are the symptoms of tuberculosis actually. This burning, oppression and soreness of the chest, catarrh with lumpy, thick pus yellow secretion. The whole of these symptoms actually relates to tuberculosis. Calc.sulph is a great medicine for tubercular patient. In children, severe cough with malaise in chest, green stools, herpetic eruptions. Pregnancy symptoms of Calc.sulph: mastitis, that is inflammation of the breast, when thick pus discharging after silesia. In most of the cases, when pus discharges, we first go to silesia. Silesia partly helps. The remaining portion is covered by Calc.sulph. In most cases, see, whenever there is pus, thick pus, you will see that the Calc.sulph helps after silesia. This is almost everywhere in the book of medicine. Heart symptom Calc.sulph: pericarditis. Pericarditis I have already described. Pericardium. This is a covering of the heart. The covering of the heart is called pericardium. Now, when this covering of the heart is inflamed and accumulates, within the space, exudative fluid, inflammatory fluid accumulates. This is swollen. Mind it, this space, small space, fine small space between these two layers of pericardium is swollen due to accumulation of fluid. This is called pericarditis. Patient feels stitching, clinching pain in the heart at every rhythm, slide with deep breathing or movement. Palpitation at night. Also, there is palpitation. Severe increase of or feeling of heart throbbing near heart area. That is pericardium region. Back and extremity symptoms of Calc.sulph. Pain in the back and coccyx. Coccyx regions lies at the tail end of the spinal cord. This is the lower portion of spinal cord. This is called sacral bone. Beyond sacral lies the coccyx, the tail end of a spinal column. Sometimes there is severe pain in this area and we cannot find any particular medicine to cure. Here Calc.sulph can help us. Hip joint disease, especially for supurating phase, needle-like pricking in the shoulder joint and knee. This hip joint, shoulder joint, knee joint. These three joints, when there is severe deep pain, needle-like pain in this joint, Calc.sulph helps a lot. Because if this disease goes on, ultimately all the joint structures may be deformed permanently. But if you can give it a restart, Calc.sulph and ferrum phos, both these and all the three joints, the trouble will be dissolved at the beginning. You can call it the problem will be nipped in the bud. Carbuncle on the back, gouty joints, acute and chronic rheumatism. Now these two terms are rheumatism, gout and arthritis. There are some problem in understanding this particular term. One is gout is this is the symptom of gout. Gout is accumulation of uric acid crystal in the joint. Uric acid crystal in the joint is gout. Severe painful disease. But when it is cured, everything is okay. No trouble is there. No trouble is there. This is actually trouble of metabolism, disorder in metabolism. But rheumatism is something else. Rheumatism when joint, big joint or any maybe small joint also, when the joint parts are involved. Here no joint parts involved, just accumulation of crystals within the tissue space, joint tissue space. Here the joint itself is affected. Both the bone forming the joint is affected, and this is due to some injury or infection, and ultimately the joint may be completely freezed, that is lost. No movement will be there, stiffness, and the patient used to suffer a great this type of. This is rheumatism or arthritis. More or less, arthritis and rheumatism more or less same term, but gout is completely different term. Last stage of gathered finger when suppurating superficially. Gathered finger actually phelon type of disease. When finger is inflamed due to some infection. Fingers stiff, cramp in scalp, burning, itching in soles of the feet. That is, all these symptoms are covered by calcareous sulph. Nervous symptom calcareous sulph. Neuralgia in aged person. Neuralgic pain. Neuralgic pain, neuralgic pain is just cutting, stabbing, pricking, throbbing, various types of pain. These are called neuralgic pain, local pain. And electric-like pain, weakness and languor. Craves stimulants to overcome tremulous weakness. That is patient craves stimulant. Sleep symptom calcareous sulph. Sleepy during day and wakeful at night. Sleepless because of thoughts. Febrile symptoms, febrile, that is fever symptom calcareous sulph. Chronic intermittent fever with evening chill. Intermittent fever, that's fever which comes and go during a day. Chills begin at feet. Typhoid, typhus, diarrhea, dysentery with sinus, that is acrid, and bloody discharge from bowels. On all these diseases, this type of discharge may be there. But when the disease is dysentery or diarrhea or typhus or typhoid is cured, there will be no discharge. But in case of previous to mention, that is ulcerative colitis and Crohn's disease, this discharge goes on and on. Hectic fever in consumption, TB. In case of TB, there is also hectic fever and other diseases with burning of soles. Skin symptom calcareous sulph, many little matterless pimples under the hair. Matterless means there is nothing but small pimples, bleeding when scratched. So small that you cannot see when you comb or you just push your fingers, there is bleeding. Cuts, wounds, bruises, boils, fester, furuncle, carbuncle. Carbuncle is picture 1. Carbuncle. Pimples, pustule, herpes. Herpes is picture 2. Severe herpes. Scabs formations. Chilblains. Crustacea, etc., etc. When in suppurating stage or in brewing stage. Maybe in suppurating stage, that is late stage. Brewing stage means starting phase. In first case, that is in suppurating stage, with calcarea mure, you have to give calcareous sulph with calcarea mure. And in the second stage, in brewing stage, in the starting phase, you give this calcareous sulph along with ferrum phos. Alternately, skin affections are generally resistant to cure. That is, skin affection of calcareous sulph are very difficult to cure. Mind this, these type of diseases are very difficult to cure. Tissue symptoms, calcareous sulph. Diseases of connective tissue, abscess to shorten the suppurating process, heal the wound fast, already described. Although stop inflammatory process and heal the disease in the starting phase, that is nipping in the bud. Very often it is necessary to, after silicea, to complete the cure. Has already been disclosed that silicea very often used first, then comes calcareous sulph. Serous tissue inflammation like pericarditis, pleuritis, already discussed. Both the thing already discussed. Pericarditis means when inflammation in the pericardium. Pericardium is the covering layer of the heart. When there is fluid accumulates and the accumulated fluid gives rise to pain, this is called pericarditis. And the same thing over the pleura, over the lung, there is fine layer like this layer, serous layer. This is this layer. This is called pleura, and within the pleural space, when some inflammatory fluid accumulates, the disease is called pleuritis. Both are painful disease, and calcareous sulph can control this. Third stage of inflammation of thick, mattery, bloody, acrid discharge from skin, mucous lining glands. This is the cardinal symptom of this particular calcareous sulph. Cardinal, the main symptom. Third stage inflammation with thick, mattery, bloody, acrid discharge from skin, mucous lining glands. There may be so many diseases, only 2 have been referred here, leukorrhea, gonorrhea, etc. Complaint from straining muscles, tendons, broken down constitution, from drunkenness. Worse from washing in water after walking or walking fast, overheated, warmed, damp weather. Better from open air, dry. With this, the video ends. Please write down in the comment section if you feel any difficulty. I will certainly explain.